program will resume in just 1 minute.
This is a hearty party. I love how much fun and joy there is in the room. It is a time to just have good news about great people, isn't it? Wonderful. So now it's my great honor and pleasure to call upon Celeste Ortiz. She's the Chief People Officer, a very modern title, at Crossover Health and a member of the Board of Directors of SCAN. Celeste?
Good evening. I'm Celeste Ortiz, and I'm here to introduce SCAN and Sachin Jain. Yes, the recipient of tonight's Champion for Health Award. SCAN is a 45-year-old nonprofit organization that was founded on the premise that life could be improved for older adults. Just a few years ago, I could describe SCAN as a Medicare Advantage plan, and a great one at that. But that was before one of tonight's guests of honor came on the scene. Since he became the CEO of SCAN in July of 2020, Sachin Jain has expanded the organization's reach. We've grown. In fact, in the last year alone, we added 60,000 new members. We've also grown geographically. SCAN has a tremendous reputation here in California, and last year we began to offer our plans in both Nevada and Arizona. And we've diversified. SCAN's mission is to keep seniors healthy and independent. Because of Sachin Jain's leadership, we now accomplish that mission in more ways than ever. As a proud member of the SCAN board, I've had the opportunity to work alongside Sachin, to see his passion for his work, to witness his enthusiasm for the cause of keeping seniors healthy and independent, and to feel his desire to improve America's healthcare system for everyone, regardless of what zip code they're born in, how much money they have, the color of their skin, or whether they even have a roof over their head. Sachin Jain embodies the spirit of SCAN and the values of the Partners in Care Foundation. And if you want to see what I mean, just watch him in action.
Healthcare is an industry right now that is really messed up. You have a patchwork of organizations that all say they want to, keep people healthy, but at the end of the day, when you look at their actions against those words, they aren't necessarily, aligned. We're in the middle of a transformation. SCAN was always a very proud organization. We have a history of making a difference in the lives of the people we serve. In many ways, SCAN is very much the same, but we also have many new ways in which we are achieving our mission and reaching the people that we aspire to serve. And that's something that the 12 Angry Seniors who founded SCAN in 1977 understood intimately. We're a mission-driven organization and here to show the art of the possible. You know, I think one of the most exciting and harrowing and humbling aspects of the last 3 years has really been SCAN's growth. The growth of 60,000 new members in our venture product, our expansion into Arizona and Nevada, other planned geographies. But more importantly, I think we've actually changed the way in which we impact the lives of the people we serve. We've launched new medical groups, we've launched new clinical programs, all with the goal of transforming the experience of aging in America.
SCAN Embrace is an institutional special needs program. We're a team of doctors, nurse practitioners. We're able to put that all together and bring it to our members.
You sleep better at night knowing that somebody's watching over everything and taking care of your meds.
Señora Gloria, ¿cómo está? Soy Lisbeth de SCAN Health Plan. ¿Cómo está, señora?
The Togetherness program is our initiative here at SCAN to reduce loneliness and social isolation. People live shorter lives if they're lonely, so we want to improve the quality of life for folks by helping them be less lonely.
Any employee can sign up for this and call and talk to a member.
The pandemic, of course, hit older adults particularly hard. We had to stop all of our home visits, and being in the home is something that is really core to what we do. We are super amazed at how many folks got on Zoom and created a lot of reassurance and outreach. We created hundreds and hundreds of bags that we were able to deliver to older adults that had basic staples in them that got them over the hump.
About a year ago, we saw that our Black and Latinx members had lower adherence rates than our white members, and we recognized that that was not okay.
We tied executive compensation to the outcomes of us moving the dial from the medication adherence side.
We reduced the inequities by about 35%. That means we possibly prevented heart attacks, strokes, and got them on the right medications and taking them.
Put your money where your mouth is, right? I mean, that's it.
We've launched 4 new companies. We also have many new faces of the organization, many new ways in which we are achieving our mission and reaching the people that we aspire to serve. My Place Health is SCAN's new PACE entity. It's built with the culture and values and person-first orientation that I think SCAN is known for.
Healthcare in Action is our approach to caring for patients experiencing homelessness. Most healthcare systems would run in the opposite direction of a population like this. What we want to do is bring care to patients out where they are in the streets, in encampments, in shelters, wherever patients who are homeless may be.
The thing that we're doing at Welcome Health is we're infusing the principles of geriatric medicine into everything that we do so that the care that we're providing is specifically designed to help this population. And we're going to do it in your home.
The current state of healthcare is actually designed for people that are healthy enough to reach it. We expect people to get up, get in their car, drive to the doctor's office, drive to the pharmacy and pick up their prescription. And so home-based medical allows us to take that healthcare to them. It's a comprehensive service. We either visit them weekly, bi-weekly to continue their chronic care. This allows SCAN to take its mission into more places.
The goal of the diversification work is to find new ways to keep seniors healthy and independent, to fulfill our mission. We've made strategic investments in Monogram Health, Safely You, Arene, and MedArrive. They are meaningful partners to our health plan. All of these organizations, whether we invest in them, we start them, we acquire them, all of them are hoping to fulfill the mission of keeping seniors healthy and independent.
I'm proud of everything that we've accomplished, but I think the thing that I'm most proud of, honestly, is the people. We have many of the same faces, but we have many new faces. One of the things as we're returning to work that feels really, really good about where we are is how strong the sense of purpose is and how motivated and energized people are about this new future direction that we're taking. We're a mission-driven organization and here to show the art of the possible, to try to change the world.
I'm all in. I'm all in. I like that.
I'm all in.
I'm all in.
Let's go.
I'm all in. I've been all in since day one.
I'm all in.
I'm all in.
Keeping seniors healthy and independent is what we do and what we're all passionate about. Always have been, always will be.
I know you all agree. That was such a powerful story. Now, before I ask Dr. Jain to the stage, I'd like to share with you some of the things I've learned about Sachin. First, UC has this tremendous history as an innovator in health service design. He gives innovation a great name. We've watched in admiration as SCAN has grown and expanded under his leadership. His knowledge of the pharmaceutical world from the time he spent as chief medical information and innovation officer at Merck, and Sachin has done groundbreaking work addressing social isolation and loneliness, and developed innovative services for older populations with complex needs. And he's experienced what it takes to make and implement policy. He was senior advisor to another hero, Don Berwick, who led the Centers for Medicare and Medicaid Services in the Obama administration. As a true testament to Sachin's impact, we ask you to read the beautiful tribute from Don Berwick on page 69 of your tribute journal. So be sure you take that and really read it. So with great honor and pride, I invite Dr. Sachin Jain to please join us here on stage.
Wow. I can tell you, I've been on this journey of trying to make healthcare better for the better part of 2 decades, and to imagine I'd be kind of with you all today on a night like this, thinking back to the first days when I was an undergraduate student, formulating a vision for myself. It's quite humbling to be here, to be in a room with a lot of people I admire, and just want to express a lot of gratitude to all of you for helping to celebrate this evening and spending this night with all of us. It's a very special occasion for me personally. It's especially special to be sharing it with Artie Southam. Artie, had some very kind words to share. Thank you, Artie. But what he didn't share is that we actually grew up 5 minutes apart from each other, and our fathers were both physicians at the same hospital. And so if anyone here is from Bergen County, New Jersey, just give me a big round of applause. Yeah. This is a special day for Bergen County, New Jersey. And if you don't know where Bergen County, New Jersey is, you're not living your life right. I just want to also start out by thanking June's and the Partners in Care Foundation and the entire team at Partners in Care. June is a hero for all of us in Southern California. Please give June a round of applause. June has been at the forefront of bringing voices of America's most vulnerable people to the dialogue about healthcare in the United States. And long before the term social determinants of health became kind of sexy in our industry, June was quietly trying to make social determinants of health a part of our vernacular, and just want to express a lot of gratitude to her for her leadership, and a lot of gratitude for the team at the Partners in Care Foundation. You put together a fabulous event. but I think, more importantly, I think you represent the art of the possible when you think about what we're trying to accomplish in U.S. healthcare as far as serving some of America's most, vulnerable patients. I want to give a big shout out to the SCAN team. You are the best. You are the best team in the business. You are some of the most special people I've had the privilege of working with. You follow along with my crazy ideas. You don't say no as much as you probably should. But we have a lot of fun doing everything that we're doing. And 2 years ago, I joined you as a stranger. And today I feel like we're all family. And I just want to express a ton of gratitude to all of you. It means a lot to me that you're here tonight. It means a lot to me that we're all on this journey together. Want to express appreciation for my family. They weren't able to join us because of COVID and some of the frailty that we're experiencing with our own family. But want to just express a lot of gratitude to my parents. I think about immigration as being almost a traumatic event in the lives of people like my parents. They pick up, come from nothing, come to a country where they know nobody, and they make a life. And they make a life for their kids so that we can try to contribute and try to make the world a little bit of a better place. And they've just been such an example for my siblings, my nephews, and just have so much love and appreciation for everything that they do, as all of us do as we progress in our lives. I think we see parts of our parents' journey expressed in our own lives, and it's just, I think incredibly humbling to be here. And I miss them, and I wish they could have been here, but just want to say thank you to them in absentia. We're at an inflection point in U.S. healthcare. I would say we've been at this, game of trying to make healthcare better for, the better part of the last 30 or 40 years. I would say in some ways, there have been just dramatic improvements in care in this country. Through the Affordable Care Act, we see 20+ million more Americans have access to healthcare than they did before. Through the scientific advances that we see through the biopharmaceutical industry, we take diseases that were previously death sentences when I was in medical school have become chronic diseases. Things like HIV and cystic fibrosis are now treatable. And so, I think we've seen a lot of progress in a lot of ways, but we're also in, I think, incredibly perilous times. Trust in U.S. healthcare has never been lower. Even though we developed this incredible vaccination, a good chunk of the American population has significant distrust in science, distrust in the healthcare system, distrust in their doctors, distrust in their health plans. It is a cause for a lot of potential cynicism. And I watched a lot of Ted Lasso during the pandemic. How many of you watched Ted Lasso? And so, and I'm also watching a lot of Obi-Wan right now. And so that gives you a little window into my life. And what I can tell you that I took away from Ted Lasso was the importance of being what I call post-cynical. Getting out of this sort of day-to-day of just kind of seeing things as being routine and starting to see the goodness in everything. And what I take away from Obi-Wan is that Disney finally figured out how to make Star Wars work. But in all reality, I think there are times when we feel in this industry that there are dark forces at play, that the right things aren't necessarily happening as much as they should, that patients don't get what they need, and it's easy to start to lose hope. It's easy to start to lose a belief that things can be better. I do have these moments of doubt where I'm sitting in quiet and wondering, what are we really accomplishing? Because some things are getting better, but a lot of things are getting worse. So, but I will say, being in rooms like this one gives me hope, gives me a ton of energy, a ton of positivity, because I'm surrounded by, I think, a group of people, a community of people who in their own ways are trying to make things better within their systems, within their organizations, within our society. And I think there's a lot of reasons for hope that
we sometimes ignore when we're looking at the big picture, because the big picture sometimes looks chaotic and unclear and ugly. But when you start to kind of zero in on what's happening at the ground level between people and patients, there are just beautiful moments every single day. I think in the early days of the pandemic, many of us were worried. We were worried about what was going to happen to us, what was going to happen to our communities, what was going to happen to our family members. And I just think about the people at SCAN who just said, let's call our members and just check up on them and make sure that they're okay, and reach out to people in a very human way and make sure that their needs are being met. I think about my mentor in this industry, Liba Lesson. Many of you know Liba. Please give Liba a round of applause if you know Liba. And I think about the fact that she defined for us a view through her work at CareMore, a view of what was possible when you actually started to innovate, when you started to move beyond the simple talk tracks that we sometimes reflect to in this industry about innovation and transformation and all the things that make us jaded, and start to think about just a basic human connection that you can actually create with people when you try to create that connection. Liba inspired me when I was at CareMore to create what was called the Togetherness Program, which was really an outreach program for lonely and socially isolated people. And I've just been so humbled to see, this little program that we started in Downey, California, extend to SCAN in Long Beach and to all the members that we serve, but also inspire similar efforts across the industry. Because at the end of the day, we sometimes lose sight of the fact that what we're here to do is to serve people who need us. And we sometimes have this tendency to normalize the abnormal in American healthcare. And I think if you take a big step back and try to be as human as possible and do as much as we can to remember that at the end of every phone call, at the end of every patient encounter, at the end of every touch is another person like us who needs humanity, who needs personal care, then we can actually deliver it. I think about a woman named Michelle who our SCAN's homeless medical group, Healthcare in Action, reached out to, and I'm very humbled by the fact that we've not only taken care of her medical needs, but we've also housed her, right? And those are the kinds of things that I think we have to focus on and we have to really connect to is ultimately the basic purpose of being here is to serve others. And so, again, I just want to say thank you to everyone in this room. I think everyone in this room embodies this spirit, but I would actually challenge all of you to go to your own organizations tomorrow morning and wake up and challenge your own status quo and ask how we can be better. Ask how we can all be partners in care. Because I think if we do challenge our own status quo, the next 20 years are going to be a lot better than the last 20 years. And we'll be able to look back at the end of our careers and say, the US healthcare system is better. More patients are being served. There's less suffering. There is more health. That's what we're all here for. And I'm grateful to all of you for this recognition, but this really is recognition for, I think, all of the work that all of you are doing and in service of others. Thank you very much.